Hey, I'm going to be assessing a newborn baby, and the first thing I would do is check his appearance as I enter the room. And he appears to have pink skin, and he is flexed, which is a normal assessment, and the flex is bilateral. His skin is pink, and it appears that his head is approximately 1/4 of the length of his body. Um, First, I'm going to check the respirations, and going to listen and listen to his lung sounds. I'm going to use, since I do not have a pediatric stethoscope, I am going to use the small side of my stethoscope. And the reason is because if you use the larger side, you could hear, since their chest is so small, you could hear bowel sounds while you're listening to their breathing. And same for the heart rate. All right, his breath sounds appear to be clear bilaterally, and I am going to put my hand on his chest to feel for his respirations. A normal respiration for a newborn is 30 to 60 breaths per minute. So I am going to listen or feel for a full minute, and that's just because a newborn baby has periodic breathing. All right, and after listening for a minute, his respirations are 42, which is within the normal limits of 30 and 60. 6 signs that I would look for to know if he is in respiratory distress is tapnea, flares of the nostrils or the nares, cyanosis, asymmetric breathing, seesaw breathing, and also grunting. This baby right here was born by a vaginal birth. If he were to be born through a C-section, the his breathing could be coarse, which could last for just a little while. And the reason for that is because the fetal fluid volume, when you have a vaginal birth, it's absorbed more rapidly due to the pressure of the vaginal birth, and when you have a C-section, process is just delayed. Next time we'll be listening to his heart rate. All right, his heart rate sounds good, and I'm going to listen to his apical pulse for a full minute. All right, now listening for a full minute, his respirations his heartbeat is 130, which is within the normal limits of 120 and 160. Now I'm going to feel his brachial pulse, which they are present and equal, and also his femoral pulse, which they are present and equal. I'm not going to assess his blood pressure. It's not something that we do on a newborn baby unless there are abnormalities that would call for that. But if I were to assess his blood pressure, a normal blood pressure would be 65/95 systolic, and 30/60 diastolic. And I don't seem to have a tape measure, but if I did, I would start with his head, and I would take the circumference of his head, which a normal circumference of a baby's head would be 32 to 38 centimeters, and his appears to be 34 centimeters. I'm also going to check for the suture lines, which they are palpable, and a small separation between each one. Also, the anterior fontanelle is shaped in a diamond shaped, and it is soft and flat. And also the posterior fontanelle is shaped as a triangle. If the fontanelles are bulging, that could be a sign of a baby who is excessively crying, or if the baby is quiet, it could also mean that they have an increased intracranial pressure. If the fontanelle is flat or sunken in, it could mean a sign of dehydration. So I'm also going to check, and there appears to be no sign of caput succedaneum, which would be localized edema in the vortex of the head, and that would be caused from a vaginal birth being squeezed through the mother and the cervix. Squeeze it because that or have edema. Also, that would heal within several days, and it is a pretty common thing. So also, he does not show signs of cephalohematoma, which would be bleeding between the peristeum and the skull due to pressure during birth. Next, I'm going to check his eyes, and his eyes appear to be symmetric, and the color is a slate gray blue color. I'm going to check his pupils, and his pupils are equal and reactive to light. Next, I'm going to inspect his ears, and the ears seem to be equal bilateral, and the top of the ear is, if I were to imagine an imaginary line between the top of his ears and the corner of his eyes, that is where we want his ears to align, and that is normal. Also, I'm going to check for skin tags around in his ears, and he does not have any, but if he did, that would be a sign of kidney or other abnormalities. Next, I'm going to check his nostrils. His nostrils appear to be clear and air flows through bilaterally, and a way that I can check for patency is to place a small catheter, but his appears to be clear. All right, I'm going to check his mouth, and his mouth appears to be symmetric. There is no circumoral cyanosis, which would be blue around his mouth. I'm going to check for his rooting reflex, and I would do that by touching his cheek near the corner of his mouth, and he should turn his head to the side that I am touching, and that is equal bilateral, and you would not want to do that at the same time because it could confuse him. All right, now I'm going to check the roof of his mouth, and the roof of his mouth is hard, which is normal, and I do not feel any Epstein pearl, which are white hard cysts that could appear on the palate or in the gums. If with the circumoral cyanosis, if he were to have an increased, not cyanosis, yeah, cyanosis. If he were to have an increased or circumoral cyanosis when he's crying, it could mean that when he is exhaling when he cries, he's not inhaling quick enough, and that could cause hypoxia, where he's not getting enough oxygen. Next, I'm going to check his neck, and his neck appears to be no deformities, and it is short, which is normal. He does turn his head to both sides, and I'm going to check his clavicle, which it is intact. Next, I'm going to check the circumference of his chest, and the circumference of the chest should be approximately 2 centimeters less than the circumference of his head, and his is 32, which is normal with that finding, and a normal circumference would be 30 to 36. His chest is symmetrical, cylinder shaped and symmetrical. His nipples are present and in the proper location. All right, now we're going to move on to his abdomen, and his abdomen does not appear to be distended. They're looking at the umbilical cord. There is no bulging there. His abdomen is soft and palpable. There's no mass felt. I'm going to listen to his bowel sounds in all 4 quadrants. All right, his bowel sounds are absent, but that is normal with a newborn baby. But I would hear his bowel sounds within the first hour of his birth. Next, his umbilical cord looks normal, and there appears to be 2 arteries and 1 vein, which is normal. All right, now moving on to his extremities. First, I'm going to check his Moro reflex, which appears to be normal, and the Morris reflex is when you extend or abduct his extremities, and then he moves back to the flexed position. So that's good. And his when I check his hands, he has a good palmar grasp reflex, and that is when I put my finger in the palm of his hands near the base of his fingers. He has a tight fist around my finger, and that is normal in both sides. Also, he has 2 creases in his palm, which is a normal sign. If he only had 1, that would be Simenon crease, and that could be a sign of Down syndrome. Also, let's see. All right, so now I'm going to check his lower extremities. Okay, the lower extremities, I'm going to check to see if he has hip dysplasia, and I'm going to do that by abducting his legs, and I don't hear any crepitus or any sounds with that, and make sure that they are of normal length, so he has no signs of hip dysplasia. I'm also going to look at the bottom of his feet and check for the plantar reflex, and that is I'm going to touch right below the toes, and his toes should curl over my finger when touched. And also, check that on both sides, and also the Babinski reflex, and that is when I guide my finger around the bottom of his foot, around his toes. His toes will flare outward, and his big toes will go to a dorsiflex. Let's see. All right, now I'm going to flip him over and check his back. Let's see. All right, so when I'm looking at his back, I am looking to make sure there is no openings on the back or down the spine. His spine looks straight and normal. There is no hair or indentions, and that could mean a sign of spina bifida. Also, I will look at his buttocks and his sacrum, and I do not see any signs of Mongolian spots, which are blue-gray markings that look like a bruise. All right, now I'm going to turn him back over. Oh, and actually, while I have him on his back, I will listen to his lung sounds on his back. And they are clear bilaterally. All right, now once I have him back over, I am going to check his genitalia, and for a male, I'm going to feel to make sure that his testes are in the scrotum sac, which his are, and also that his meatus is at the tip of his penis, and that is normal. If I had a female, the labia majora would be dark, and it would cover the clitoris and the labia minora. I'm also wanting to check his anus to make sure that it is patent, and it is. So it looks like I have a healthy newborn baby. Thank you.